Good evening, and welcome to The Banana Stand. Today we're interviewing Dr. Frankenstein, a reproductive endocrinologist who specializes in IVF, a revolutionary procedure designed to help couples in need of alternative ways to breed. More and more couples are suffering from infertility and are turning to IVF as a viable solution to induce pregnancy. IVF stands for in vitro fertilization, a process in which an egg is fertilized by sperm outside the body. The fertilized egg is then reintroduced into a woman's uterus in hopes of implantation. We've contacted Dr. Frankenstein, an OBGYN who specializes in reproductive endocrinology.
Hi, thank you so much for having me.
Thank you so much for coming. So, doctor, why would someone consider in vitro fertilization?
Well, one of the reasons why someone would consider in vitro fertilization is if the woman does not ovulate regularly. This is a problem that we're beginning to see more and more, and we're just really happy that IVF is able to help these women. Another reason why we might consider IVF is if a woman's fallopian tubes are missing or if they're blocked. The reason this is a problem is because usually fertilization occurs in the fallopian tubes. So if they don't have fallopian tubes, we have to look at alternative methods for fertilization.
That makes sense. Now, Dr. Frankenstein, I know that a lot of couples are unsure or concerned with the use of stimulating hormones. Are there other options for these couples?
Absolutely. Every woman looking into IVF has a different fertility issue that needs to be discussed with her doctor. However, there is the cheapest method that we do. It does not involve hormones, and what we do is we observe a woman's natural cycle. We determine when she's ovulating, and then go into her ovaries and remove the egg just as it's about to be released. However, this only results in the retrieval of one egg, which reduces her chances of implantation and her carrying out that pregnancy.
Doctor, what about women who suffer from irregular cycles where ovulation cannot accurately be observed? Is there a way to induce ovulation, or are there options for these couples?
Absolutely. This is similar to what I was just talking about, where we would have to induce ovulation. One way that we do this is through long ovarian stimulation, and that usually results in the harvesting of about 12 to 15 eggs.
It sounds like it would have a much higher success rate. Can you explain more about how long ovarian stimulation might work?
Absolutely. It's a bit of a process, but I'd be more than happy to go over that with you. The very first step that we do is called controlled ovarian hyperstimulation. We basically use what's called a gonadotropin agonist protocol, which prevents premature ovulation. The next thing that we do is we stimulate multiple follicles of the woman's ovaries through daily injections, and that's usually what you see on the TV shows when you have a woman constantly injecting herself. That's what she's injecting herself with. We then use ultrasound imaging and hormone assessments in order to monitor the follicular development. Once a desirable amount of follicles have been reached and they're the appropriate size, we go in and we harvest those eggs and complete the maturation of those eggs, which are then called oocytes.
Well, it's a trouble pronouncing that one.
Yeah, I know.
I believe it's oocyte.
It's
oocyte.
And we monitor this by administering human chronic gonadotropin, or HCG.
Dr. Frankenstein, this sounds like a lot of work for the patient. What happens after the long cycle has been completed and the oocyte, or immature egg, has been developed?
Well, then egg retrieval is scheduled for 34 to 36 hours after our COH treatment. The eggs are then placed in a special media, which is then cultured in an incubator until it's time for insemination.
So why are they called test tube babies? Are the babies actually produced in a test tube?
No, they're not. It's actually a bit of a misnomer. Insemination is done in a dish, like a petri dish that contains the eggs, and it's monitored under a microscope. Upon fertilization of a mature egg, it is transplanted into the mother with a catheter, which is inserted through the cervical canal and then into the uterine cavity. Ultrasound technology is definitely used to help guide this process.
Frankenstein, my wife Iman is pushing 40, and I know that near these ages there can be some complications with birth for the mother and for the child. Does IVF carry these types of complications along with it, or is it safe for a middle-aged woman to undergo this procedure?
That's a really great question. We do really encourage women to take age into consideration. Women who are approaching the age of 35 are definitely more likely to require more rigorous drug stimulation. This, of course, is going to increase the likelihood of effects from medication, and it also increases the likelihood of just different complications during pregnancy.
I see, Dr. Frankenstein. This has been an extremely informative interview. I hope our audience has learned a lot about IVF and the risks and the benefits. Thank you so much for your time. It was a pleasure having you.
Thank you so much!